Good afternoon. And in the essence of time, because I do know you have a very full schedule for your briefing today, there are lots of things to cover, so I've abbreviated a little bit. Same content, but we'll just start with some metrics at this point. So we will go over the COVID-19 metrics. We will talk about recommendations based on the current metrics, vaccine updates, and our campaign for the next 30 days. And so what you're seeing here are our local metrics, and just to note that we did have our cases decrease. So from last week, which were 351, we are now seeing about 295. We did also see the percent positivity decrease for the first time in several weeks. You might remember me saying that for about 4 or 5 weeks it was hovering in the mid-9s, and now we're seeing that fall below 9% and at 8.3%. The deaths did remain the same, so unchanged, and that's roughly about 13, 14 deaths. And the hospitalizations have remained high, but stable. They've been bobbing up and down, but for the most part, stable yet very high. Same with the percent ICU beds occupied by COVID. We did see that increase just a little, but again, very high levels, but some leveling off. So I did want to say that there's some good news there. We are seeing cases decrease. We are seeing that percent positivity decrease after several weeks of what felt like some leveling off. So that is a welcomed sign, but these levels are still far too high. You can see there that we still have lots of red and orange, particularly in those upper indicators. Our cases are still similar to what we saw in late January and early February, and our percent positivity is still not 5% or below. And so with that, because the levels are still so very high, with that sustained high transmission in our community, Public Health is recommending extending the face covering requirement for indoor public spaces until October 29th. I did want to give you some vaccine updates that by the numbers, that we have about 65% of our total population partially vaccinated, as indicated by our graphic there. That is about 169,514 people with at least one dose. That Buncombe County HHS has administered about 99,700 total doses since December of 2020. And last week, we saw about 265 first doses administered since week prior. I did want to just briefly say, without showing all the graphics that we usually do, that our 25 to 49-year-old age group has caught up with our 50 to 64-year-old age group, and both are around 66% partially vaccinated. Our 18 to 24-year-olds are still a bit of our straggler group, with about 56% partially vaccinated. And we continue to see a slow, steady increase in our 12 to 17-year-olds, who are now at around 51% partially vaccinated. And I did just want to reiterate that we continue to provide services at our 40 Cox location, which is where the health department is located, and our outreach events. And so I did want to go over some recent developments because it has been a busy couple of weeks since I saw you last. That we did see the FDA recommend Pfizer booster for particular populations, and that is 65 years and older, at high risk for severe COVID-19, and at high risk of occupational exposure. Just a reminder for folks that that's just step one, that we still have a couple of other steps that have to go. So the FDA has recommended. We anticipate the CDC and Sept to be meeting tomorrow, September 22nd, and are anticipating that we will have some recommendations that come out of that. If that is true, then we would be waiting for any additional guidance and provider guidance that would come down from the North Carolina Department of Health and Human Services, and then be looking at starting boosters if they are recommended and approved by all parties to begin those next week. We also had in the last couple weeks the federal vaccine requirement that came through. The federal administration did announce a vaccine requirement for federal employees, healthcare settings that participate in Medicare and Medicaid, and businesses with 100 or more employees. It does appear that the federal employee compliance is by November 22nd. More guidance and information forthcoming for businesses, that the reports were showing roughly about 2 months after that announcement that we could see that potentially go in. But I did want to say that all of those things are impacting our current vaccine operations. And so with that, that we have the anticipated federal vaccine requirement coming, I thought it was really important to tell you all, okay, so there are lots of folks who are covered in that. Let's talk about folks we've already reached, and then talk about how we reach maybe some folks who may not be totally included in that and maybe haven't quite come to us for other reasons. And so I did want to mention just some of the things that we've done already, including our mass vaccination efforts for the general population. You all remember that. We were at AB Tech for many months. We do still have our fixed site operations at the health department for the general population. And as I mentioned, about 99,700 total doses administered, with about 3,000 of those in outreach settings and roughly 2,500 of those in equity outreach settings. We do also have our mobile efforts to the long-term care facilities, our at-home mobile efforts to the homebound. We have done 4 specific events for our homeless population, 2 specific events for our migrant farm workers, and we have over a dozen of events that were for work sites. And for our school-aged children, we had summer partnerships with many of our schools in the area to reach eligible children and their families, and that resulted in 13 school events with administering over 360 total doses with those. So with things that have been happening in the last couple of weeks, how do we reach the others that may have been waiting to vaccinate? So between the efforts that we've already made and continue to make, plus the anticipated impact of the federal requirement on businesses, I wanted to share with you all what our team has been putting together and kicking off actually today. So I'll talk about that in just a second. That our plan will hopefully reach those that may not have been included in what we've already done, maybe haven't been or won't be included in the federal requirement, but may still be open to vaccination. So we're affectionately calling this right now Operation All In, and welcome better names if you have one. But efforts here are to increase vaccination rates that will include events, partnerships, and campaign tactics, including additional vaccination events throughout the county, local vaccination incentives, and partnership with trusted community organizations to provide access to vaccination throughout the county. I did want to highlight working with a local marketing agency to coordinate a very integrated ad campaign featuring local residents encouraging vaccination. And these are many of what I would call non-traditional public health and vaccine champions. When I think about your public health director, that's a very traditional champion of vaccine. But these are folks who are living in our communities. They are respected folks in our school systems and in our other community settings. The campaign will interface with the regional My Reason WNC for a lot of reasons, but for one in particular is that as we concentrate on this 30-day push in our own county, we know how very important it is to make sure that there are that same messaging and that same campaign throughout the region, as many folks may work in our county but live somewhere else and vice versa. So really leveraging and utilizing that partnership in the region. And just to reiterate, again, engaging schools, vaccine providers, and community members. And I just wanted to highlight some of the great work that our team has been doing, particularly our comms director, Stacey Wood, around developing a PSA that will feature a local champion from Irwin High School who oversees our junior ROTC program. So more to come on that. And then just lastly, parts of that campaign as well, that we want to learn from our youth community, in particular, of ways to educate, inform, and motivate their families to learn more about the safe and effective COVID-19 vaccine. So looking to get that qualitative data that will help inform how to better engage families and communities. We continue to have our vaccine efforts that engage local vaccine providers in a coordinated way. We continue to meet weekly to talk about where are the access points that are needed for vaccine and who can do that, whether it's Buncombe County HHS or whether it's one of our FQHCs or even a state vendor or even FEMA when they come back into the area. So better use of that collaborative support. And then I did want to mention that we do plan to extend those mobile outreach events, particularly the kickoff today being at Ferguson Family YMCA, tomorrow at Inca Middle School, and on the horizon, a focus to the North Buncombe area as well to provide some additional access to vaccine for folks who may not be opposed to vaccine, but just haven't done it yet. And then just of note, it doesn't have to do with vaccine, but it is very important. I did want to say that we are going to be seeing expanded testing opportunities within our county as well as the DHHS state vendor StarMed, who we have been partnering with for testing, is going to begin offering their services Monday through Friday, beginning next week at Harrah's Event Center. And that particular vendor, this will be a somewhat temporary spot for a few weeks, and they are very interested in having a much more permanent and fixed site to be able to provide that testing and vaccine opportunity much more regularly. And if the space is available and can work for them, they may be able to do their complete operation, which could include the monoclonal antibody treatment, so access to that as well, as they look for good space for that. And as I wrap up, I just want to remind everyone that you can visit myspot.nc.gov to find a vaccine provider near you. If you are listening to us and another vaccine provider is closer to you, then we want you to go where it is easy and convenient for you to get your vaccine. And if you're out our way near the health department, we will gladly vaccinate you as well. And that's it for today for me.
Thank you, Stacey.
I got a couple of questions.
the first, you showed us a slide with the 65% of Buncombe County slide. I think you said 265 first doses were given last week. You've talked about this before. Is that just through Buncombe County vaccination providers and
Yes.
not?
That's just us at
Schools
Buncombe County HHS.
Okay.
First doses last week.
And even if we could, like, we have no way to calculate the total of all private, public providers on vaccinations per week.
I don't get a weekly report on that. I'm sure if I looked at day-to-day changes or week-to-week changes from the dashboard, we might be able to sort of estimate that, but I don't get a weekly report or daily report that specifically says how many doses have been given out by all providers.
Okay. Yeah, I mean, as you might imagine, if the data was available and accurate, seeing some sort of line graph over time that showed week to week our first doses going up or down would be super helpful to us, I think, but I imagine that's maybe not possible, but just a thought.
I don't have it for all Buncombe County providers. What I can tell you is for the second week, we did see a slight decline in first doses. So we had hit a high a few weeks ago and then started to see that come back down into 265 last week, the week before 217. So starting to see that wane.
Probably follows the state line graph, I imagine. Yeah.
It likely does.
Yeah, okay. And then you mentioned in regards to the Department of Labor requirements coming out, you said 2 months for something. We're waiting 2 months for something. What was that?
And so when the announcement was made by the federal administration, there were reports that indicated that OSHA would be coming back within the either 65 or 75 days with those with that guidance.
The fine print.
That's correct.
Yeah, okay. And then last question, for StarMed testing starting the 27th, for folks listening that want to make an appointment for getting a COVID test, what would they do?
Thanks for that question. So I will tell you that was confirmed today. So I am not sure if you looked at the testing site, the Find My Testing Place website, you would see it today. So give it a few days or a couple of days. And then what folks can do is go through either the StarMed website themselves to register if they'd like to, or they can go to the North Carolina DHHS Find My Testing Location website and put in Asheville, and it will come up as an available opportunity for testing. And I apologize if I didn't mention it. Those hours will be Monday through Friday, 10 to 2.
Thank you.
Just a quick question on what we're seeing in terms of children's cases and the trend lines there.
Yeah, so not much change since the last time I saw you. That you might remember a few weeks ago, we did see that increase from about, we were seeing an average of like 14%, and we saw that jump up to about 20%, and then it went just a little bit higher, and it's staying right there in that mid 20%. I believe, I wrote it down thinking that you might ask, that it is about 26% of all new cases were less than 17 years old. And that's about the same as it has been. And I did want to follow up that Commissioner Whitesides had asked about private schools last time and their masking policies. And so we did a very simple survey of private schools. And of the 31 private schools, we had 24 who responded. And about 84% of those schools are requiring universal masking.
All right, great. Thank you, Stacy. Appreciate it. All right, the next item on the agenda is the landfill to gas project. And Dane Peterson and Christy Smith are going to help.